Welcome to our studios here in Washington, D.C. I'm Mike Walter. Explosive pandemic potential. 3 powerful words from the World Health Organization as it delivers an urgent warning about the mosquito-borne Zika virus. The disease is already affecting about 24 countries. It's also linked to a spike in birth defects. Our Jim Spellman is following the latest developments, and he joins us from our newsroom with the latest. Jim?
Mike, researchers say the Zika virus was likely introduced in South America less than 2 years ago. It's already become a major public health crisis.
The Zika virus is now in 23 countries in the Americas and could infect up to 4 million people in the next year. The World Health Organization is scrambling to address the crisis.
The level of concern is high, as is the level of uncertainty. Questions abound. We need to get some answers quickly. For all these reasons, I have decided to convene an emergency committee under the international health regulations.
The emergency committee will meet for the first time on Monday. The virus is spread by mosquitoes and appears to be linked to birth defects called microcephaly that causes babies to be born with undersized heads. The virus is named for the Zika forest in Uganda, where the disease was first identified in the 1940s. The virus is proving much more dangerous in the Americas, where it's essentially a brand new disease.
We have a new virus. Zika is a new virus introduced. There is no immunity. So we would expect huge numbers of infections, some detected, some not detected.
Zika has arrived in the U.S., where authorities say there are 31 confirmed cases, all travel related, plus another 19 in Puerto Rico and 1 in the U.S. Virgin Islands. The White House expects there will be more infections later in the year.
The January temperatures in North America are quite inhospitable to the mosquito populations, but obviously that's going to change. Eventually the mercury is going to start to rise, and we need to be mindful of any sort of potential risk here in the United States.
There's no specific treatment and no vaccine. Better diagnostic methods are being developed, but it could take months, even years, before they're developed.
The focus now is on widespread mosquito eradication and advising pregnant women against going to areas where the virus has been detected. Women living in the affected areas are being asked to avoid becoming pregnant if possible. That's not always going to be easy advice to follow, Mike.
Jim, give us a sense of why this lightning-fast movement of this disease.
Well, several things have come together at once. As we mentioned, people in the Americas simply don't have immunity to the virus, and without a cure or a vaccine, there's simply nothing to slow the spread of Zika. And the WHO says the El Nino weather phenomenon has created ideal conditions for the mosquitoes to flourish. Several things coming together at once, Mike, to make this incredibly dangerous.